Hi everyone, my name is Sydney Wilson and I've decided to do my individual informative presentation today on polycystic ovarian syndrome. I chose to talk about this medical condition because it is something that is really close to my heart. I was diagnosed with this about 5 years ago and I feel like education on this topic is important, so I'm excited and grateful for the opportunity to be talking to you today. Now, to start off, I want you all to picture yourselves back in high school. The same anxieties that you faced in 10th or 11th grade. You're thinking about overdue assignments, who you're going to hang out with at lunch, what class is next, and you might have even just started driving and you really want to impress your crush who's sitting a couple seats away from you. My only questions to you would be, are you sure you should be wearing that? And did you put on deodorant? Now, you're about to go stand up and give a presentation in your 4th period history class. You're so ready for the day to be over and you've been feeling gross and achy all day. But the second you stand up, suddenly you get a really big ache and pain in your lower abdomen. It's so intense that you fall to your knees and end up passing out in front of your entire class. You're already embarrassed because of the stage of life that you're in, but this just made it worse. You get wheeled away to the nurse's office and eventually get sent home being told that it's just bad period pain and ibuprofen should take care of it. Little do you know, even though the pain goes away in a couple hours, this is going to start happening semi-regularly. Every few months you're going to have an experience like this or extremely painful periods that prevent you from going to school. You go to see various doctors and they refuse to run tests, and it is just a never-ending discussion of, well, here's another pain medication that you can take, or maybe we could do an elective surgery. But none of those are options that you know enough about to really be able to face. Now what this is the unfortunate life of a woman with undiagnosed polycystic ovarian syndrome. Polycystic ovarian syndrome is a prevalent yet underdiagnosed hormonal disorder that affects roughly 13% of all women globally, and only about 6% get officially diagnosed. Now these statistics are even more prevalent in underdeveloped nations with limited access to healthcare, and so these statistics aren't actually accurate because we don't have enough information to know how many of them actually face this and or if they're getting properly diagnosed. So it is really important that we are aware of what polycystic ovarian syndrome is, the common symptoms, and also the common misdiagnoses so that we can support the women in our lives. Now, what exactly is polycystic ovarian syndrome and why isn't there more discussion about it? Now, polycystic ovarian syndrome is caused by hormonal fluctuations and imbalances, most commonly with the hormones testosterone and cortisol. These hormonal imbalances cause follicles on your ovaries to be stuck midway through development, and over time they can accumulate. Not everyone with polycystic ovarian syndrome shows that symptom of polycystic ovaries, but if they don't show that, then most commonly they show irregular menstrual cycles. Now these hormonal imbalances don't only affect your ovaries, but they affect your quality of life, and they can be controlled by hormonal medications, but overall an official treatment has not yet been discovered due to limited research. Now, what are some common symptoms that come with polycystic ovarian syndrome? The most common symptoms that come with this are fertility challenges, weight changes, irregularity of menstrual cycles, and fatigueness and tiredness. Now, I know personally in my life, I have experienced a lot of fatigue and tiredness, irregularity of menstrual cycles, and weight fluctuations, which all around has impacted my self-esteem, both today at 23 and back when I first experienced symptoms at 15. And that is something that is just not an awesome thing to experience for anyone. We see records of these symptoms all the way back in 460 BC when Hippocrates published a book called Diseases of Women. One of the quotes from this book says, "But those women whose menstruation is less than 3 days or is menarche are robust, with a healthy complexion and a masculine appearance, yet they are not concerned about bearing children, nor do they become pregnant." Now, the symptoms that we can see here in this quote are masculine features, and that can come from the imbalances of testosterone and the inability to bear children, which tie in those fertility issues and symptoms that can come with this condition. Now that we know what PCOS is and some symptoms, it seems pretty clear. But why do doctors commonly misdiagnose PCOS? Well, this can come from the history of PCOS throughout the time of growth. You can see that starting right after fetal life, studies have shown lower neonatal growth. Now, this can be attributed to many factors like environment and what the mother ingested throughout the pregnancy, but we also know that it can be linked to a future polycystic ovarian syndrome diagnosis. The next significant period of time we call childbearing age, which is between the age of 16 and 35. Common side effects that we discussed, or symptoms that we discussed earlier, were weight gain. And that can be diagnosed as diabetes, as high blood pressure, and obesity, which we see pretty frequently in that childbearing age. And then finally, in the postmenopause, many of those women encounter breast cancer and CVD and endometrial carcinomas. Now, all of these most commonly the practice for a doctor is to treat the symptoms and not the underlying disorder. And studies have shown that by actually looking for symptoms of polycystic ovarian syndrome, you can see that they are connected to this diagnosis. And finally, just to recap what we've discussed today, we have talked about what PCOS is, what some of the symptoms are, and common misdiagnoses. It is so important that we are educated about these things so that we can be aware of our own bodies and protect the people that we love and get them the treatment that they need. So thank you so much for listening today.